the research was bad. It was methodologically really good research, but it may have been of interest to a niche audience. Maybe it was a study done in Nova Scotia, but that had already been done in several other provinces, and that's not high impact enough. And so we developed this journal to try and get information from, again, starting with Canadian, although we have a lot of international submitters as well, but to try and get that information out to a Canadian audience. So those are the two journals that we have. The one thing with CMAJ Open is that it actually uses an open peer review process. So reviewers' comments are published along with the original version of the paper and the final version. So there's a training aspect. So if you want to if you've never done a peer review, if you're a fairly junior, never done one, you want to kind of see what peer reviews look like, it's a great journal to go to because you can kind of see what peer review comments actually look like. All right, the picture of a train is not just because my dad worked for the railroad, but railroads, of course, ruled, right, for quite a long time. And then trucks came in, right? And some railroads went, oh my goodness, what are we going to do? The trucks are taking over. And some railroads folded. And other railroads said, you know what? We're actually not in the railroad business. We're actually in the transportation business. Our job is to move information from one place to another. So although we used to be all about the railroad, we're actually about trying to move product. And so what they decided to do was to actually work with trucking companies and shipping companies and airlines to try and put themselves in the process of moving. So they moved from being I'm in the railroad business to I'm in the transportation business. That is what journals have to do to compete, to remain relevant in today's society. So we're having to rethink about what we're about, that we're not in the publishing journal business, but we're in the knowledge business, and to find where our home is in that knowledge business. So I'm going to talk to you about some of the trends and initiatives that are happening in the journal world. This is a select, there are so many things. When I was trying to sort of hone down which ones, there's so many things going on. So I tried to pick sort of the hottest things right now. If afterwards you have questions or want to talk to me about some of the other things, but these are the ones that I thought that you might be most interested in. So there are 5 main areas that I want to talk to you about, and the first one is the area of transparency. So one of the big things, this is an initiative that some of you are aware about, is the issue of data sharing. This has a dual role. One is if your data set is out there, people can check and make sure whether your research is okay. It obviously also helps other researchers to be able to do work. Our editor, CMAJ, and our editor with that, John Fletcher, is actually a member of the International Committee of Medical Journal Editors, which sets actually a large part of the standards for journals around the world. So be prepared that there will be a statement next year where ICMG journals will probably be requiring people to make their data sets available. Now, that doesn't mean that you will need to give it to some people are doing health services research and their data sets are already available, like if the Ontario data sets. But you may need to put them in a repository. This is just an example of one repository. But just be prepared that is a big initiative. Some journals are already doing it now. BMJ is a notable one. But be prepared that is going to be coming down the pipeline. So. Another thing, some of you are aware of this, a few things about authorship. Again, this is also in the area of transparency. There's now a 4th criterion for authorship for journals that adhere to ICMG standards, and that is that if you're an author, you have to act as a guarantor of the work. And why that was put in there was, the classic was, an issue would arise with a paper and we couldn't find the PI. Sometimes the PI was climbing in Nepal. and was like, not available. And then we go to the second and the third, oh no, I didn't have anything to do with that part of the paper, no, And so what we're basically saying, if you're an author, you are responsible for the paper. You have to, if we can't find, we go down the list, but if we can't find the people at the beginning, we're going to go right down to the end until we find someone who can, and so you have to be prepared to act as a guarantor. So if you're putting your name on a paper, make sure that you are comfortable with all aspects of the paper, including the analyses. Another big thing in the transparency area in authorship is identifying who these authors are. And how many of you have ORCID IDs? Does anybody have an ORCID ID? A few of you do. I would highly, unless you've got a really, really unusual name, I would highly recommend that you get an ORCID ID. Just Google ORCID. The problem that we have is, particularly you have people with similar names, and we're getting obviously a lot of research out of some countries where names are quite similar, is that it's hard to tell who is actually the author. If you've ever gone on PubMed and you put in an author's name and you're like, okay, is this a dentist? Is this a surgeon? I don't know. Wow, it's sort of interesting areas of research, very diverse. And then you realize, they're actually like 4 different people with the same last name. So if you want to get credit for your work, get an ORCID ID. Then you can, when you submit to any of the medical journals that use Scholar One, you can put in your ORCID ID, and then it'll be credited to you. So this is another thing that's a big thing in the area of transparency. Another big thing, you obviously know trials need to be registered. There's going to be more requirements for registration coming down the line. I think most of you who do systematic reviews are familiar with Prospero. I encourage you to register your systematic reviews there, but there will be more registries that are going to become available. What we'd love to see is that most studies are going to be registered. This is helpful from a variety of things. It helps you to keep on track, but it also helps journals and readers to know whether things change as your study has gone on. And I can tell you that trials that are submitted to us and systematic reviews that are registered, we do go back and look, and sometimes we've seen people have switched their primary and secondary outcomes because their primary, there was nothing, the secondary looked great. This is another direction. You're probably going to see more from the ICMG on JE on this point. There are a bunch of other sort of projects that are going on, just to let you know very quickly, linked publications. Those of you who have been in trials, we get dozens of papers out of them. Sometimes it's really hard, and for anyone who does systematic reviews, you know how hard it is to try and collect all the pieces of that study. So we're actually involved in a research study right now with a large consortium of journals and other groups that are going to be linking these studies together so that if you're looking at one trial, you'll actually be able to find all the papers that came out of that trial. So for those of you into systematic reviews, this is going to be very, very helpful in the future. Version control is another initiative. I don't know if any of you, when you go onto BMJ, you see they've got something called Crossmark. I don't know if any of you have seen that. With the fact that we've moved away from paper journals and we're now mostly online, for example, most journals, the paper journal is not the journal of record, it's the online one. Authors will come and say, ooh, I got that number wrong. I redid that analysis, I don't know what I was thinking. And they just want us to change it. But like nothing ever disappears on the internet, people need to know which version is out there. So there's a lot of work being done about how, somebody go, why do you have to put in a formal correction? Can't we just go in and correct it? And it's tempting sometimes, it'd be so easy. But this is one of the issues that we're dealing with, how to make sure that the version you're looking at is the correct one, and to let people know when things have been changed, because sometimes the changes, as you know, sometimes people have gone and they've changed their analysis, and it has made a huge difference. Protocols being published, as you've seen more and more and more protocols being published. I highly encourage you to go and get your protocols published. CMAJ Open, we publish them. Other journals, many journals do as well. That's a great way to get feedback from peer reviewers before you start your trial, but also from readers afterwards. Sometimes, you know, it's so sad when people have done this very expensive study and they bring the finished result, and then people go, oh, wow, there's a fatal flaw here. Like, we can't publish it. You know, and that has happened. And a good way to sort of step back and hopefully is to get your protocol published and get that kind of review. And the other thing I talked about already is open peer review, like we have at CMAJ Open. Other journals have started to do that. So be prepared that more journals, if you're a peer reviewer, are going to be asking you to sign your name to your review, and then possibly even have your review published. What this does is it makes us all nicer to each other. I don't have to edit so many comments like this is the worst study I've ever read. I can't believe you send it out for peer review. But also hopefully the peer reviews will be more constructive sometimes at times, and will. And again, as you know, one of the big issues is to make them constructive and more fulsome. I mean, sometimes literally we get people check accept. Like on a first read of a study, I mean, that doesn't generally happen. But like I don't think we've ever accepted a study de novo. But it's not a helpful peer review, and people just go accept. And of course, I'm just going to mention competing interests. It's still hot. Still a hot topic. I won't go into it. I think you've probably had that talked to death, but competing interests is still out there, and there might be some tweaking of timelines and the kind of things related to the competing interest side. Next thing I just want to talk to you about is another area that we're working on, is the area of quality. Are most of you familiar with the Equator Network and reporting guidelines? Does people know about Equator? Okay, again, just Google Equator Network. There are guidelines, reporting guidelines for almost every study you can think of. A lot of journals, CMAJ is one of them, CMAJ Open, many others as well, actually ask for you to submit completed reporting guideline checklists. If you are doing a study, and there are these guidelines for, obviously, consort is, you know, Prisma, Moose, there's just tons of them. But they actually really, really help you to focus when you write a paper. So we like to have people submit it, because then we know that people have gone and looked at these aspects. But if you're doing guidelines as well, there's Agree, for example. Agree 2 is a good one. Go and look at these. And when you're writing your paper up, go through. Everything that you need to include is in these checklists. If it's not there, I can guarantee you that when it comes back from peer review, you're going to be asked to put it in. So you might as well put it in at the beginning. So go to Equator. A lot of journals are going to be requiring this more and more. Take a look at the guidelines there. They're very, very helpful. So this is another area that we're dealing with in quality. Peer review is a huge area of research and interest right now. I don't know if you know David Mower. He's from the University of Ottawa. He's part of the Equator group, but he's doing a lot of work. I think, you know, if you've ever heard talks on peer review, you know how flawed peer review can be. But yet it's such an important part of what we do, because I was talking with people earlier. I mean, I get papers in on things I know zip about. I'm a family physician. I know, as the classic, I know a little about a lot. But there's certain areas, you know, and that's why we rely on subject experts, methodologists, to make sure that we get it right. And yet there's not much training that's out there. So you're going to see more training courses, and actually Ottawa is actually offering a training course in their EPI program for peer review. Open review I've talked about already, and you're going to see as well that journals are going to increasingly have checklists and standards for what they expect. Again, not to make it onerous, but to actually give people a framework to be able to provide the kind of feedback that we know you want to provide, but be able to do it in a structured manner.